the food to be digested properly, it has to be tasty, not only healthy. If it's only healthy, it's not enough.
In Ayurveda scriptures, very old script, 5,000 BC ago, wherein it's mentioned that the daily regime, we call it as dinacharya. It's called as a daily regime. So one of the first thing that we need to detox the things of the mainly the oral health. If you see the formation of the plague is nothing but an microbial film, biofilm that forms. So it is nothing but a bacterial thing that is there, and then you have a useful bacteria which is required for our for our survival, for even digestion, and then even for the health, having a good potential where it can form a complex for with many other things and make it as a bioavailability happening on that stress relieving when you do after the it is not only the oral health and then about the teeth, so are the gums. So even when you see that facial muscles which takes a lot of stress, that also by doing this gargling will be relaxed.
Hello, everyone, and welcome to our amazing podcast, The Gut Health. So many revolutionary ideas we have brought, and that's our idea to bring. So, everyone wants to be healthy, everyone wants to be happy, but how to achieve that? And our focus is that really, with the gut health, we can actually have the full health of the body, physically and mentally also. And we have a very, very special guest today with us. This is Dr. Reddy from India. He is the chief researcher of the Sri Sri Tattva brand, and he has more than 20 years of experience of Ayurvedic medicine, formulations, inventing formulations, and it's really, really an honor that he has this time with us because he has also both the experience in the scientific side, also the practical side of Ayurveda and the Asian knowledge. So welcome, Dr. Reddy.
Yeah, thank you, Constantine. It's nice to be on the same platform and discussing about some of the good things about Ayurveda and how it helps for the
Yes,
people health
yes.
and
So
happiness. Yeah.
thank you so much.
Yeah.
We have been talking here how our dental health is connected
Okay.
to our gut health and subsequently the mental health.
Okay.
Can you explain, just as a start, we want to discuss how simple spices or herbs like cloves, cinnamon, black pepper, and others work on multiple levels, not only on our dental hygiene, but also on the gut health. My question is, in Eastern Europe and in Bulgaria, where I'm from, we all know that cloves, and especially clove oil, is very good when you have a toothache, some inflammation. We put that, but can you explain how does this work?
Yeah, Kans, it's a very good topic, the oral health and the gut health, because these two are not separate. They are two very much connected. See, maybe we can start the point, the oral health, from the mouth and then the gut. So it's the starting point, and it is connected physically. And at the same time, if you see the deeper level, it's in the microbiome. We consider that where the colonies of the where how it is, where the gut has something damage or something affecting, it will be shown in the mouth. So we used to in Ayurveda, so that's why it is called as a one of the examination. It's called as Astasthana Parikshas, 8 parikshas we do for the well-being, how the patient is evaluated. So in that, the tongue is the where it is evaluated, how it is coated, or if there is indigestion or any feeling in the gut, any ill health. So that can be known by that time. So that the same thing, if you also see that when you this can be observed as a common man. It's not that like no from the doctor perspective or the physician perspective. When you have a fever, when you have you not feel any taste for them, so it's a tape, like no, that is where it is a reflection. We call it as like no, how we call it as microsome is connected to the macrosome. The same way, it's a body. It's a like no, end of the day, it's a one body which is having one part which is connected to the gut. It's a starting point, and it is healthy the both ways. If the end is healthy, tail is healthy, head also is healthy. So the same way we can connect it. So we can't keep it separately. So these two are very much connected. And then the where the flora of the mouth and the oral things. So it is the same thing that will be good bacteria that will be present. And what you when you do the when you have take a food in and how it helps in the digestion, it will start from the mouth. The same thing will be down the line, like when we go to the gut, MLAs or the saliva, what we have in the mouth. So it is not only just a secretion, but it helps in the starting point of the digestion. And then the feel of it, like if you don't like feel not feel like eating, then you will not like anorexia we call it as, where you'll be finding that like no vomiting type of sensation. So these are all will be reflected in the mouth or in the oral, that you will feel the sensations. So though the signal is from the gut, but this we will be feeling here in the mouth. And it's very good to know that, like, no, in the Bulgaria, though it's ended in Indian custom also, the clove oil is used for some centuries in Ayurveda perspective, and also because of the presence now, it is very much researched herb, where the eugenol, which is present in the like no active, we call it as active component of the olive or clove oil, which helps as an which is the and having an antibacterial thing or antimicrobial we can consider. So that is where when is the toothache. Toothache is nothing but a cavity that is like no destruction happened by the microorganisms. We call it as a bacteria. So that bacteria, then it causes the pain. So where you once you apply that, so it is able like the oil presence of eugenol will be acting as an antibacterial and killing that thing and then controlling the bacterial, and the pain will be subside. So it is good to know that the custom that in the Bulgaria also very far, like in the tradition, and in Ayurveda also it is very much used. So it is Ayurveda, the clove is used not only as a spice, as a culinary and cooking and this thing, but it have a very good medicinal values because of presence of by the scientific phytochemistry by like eugenol and other components, which is having a good effect of the digestion and then improving like no spasmodic. So these are the some of the characters that will be there for the clove, which is used for the like not only the oral care, but even for the treating the disease of the gut also. So they're the same when it is applied in the at the gums or the bleeding things. So it can be used as a clove oil as used a mouthwash. So where it will be helpful, clove oil, some 5-6 drops in a glass of water, and do the gargling. So that will help you to take out the pain, and also the any antimicrobial properties will control the decay further, and it will protect the oral health. And at the same time, because of its nature, we call in Ayurveda like no, where it is a stimulant for digestion also. Stimulant for digestion. So that will be that is where we can consider clove as the best property of the thing that can go into the oral health. The first we can give that.
It is basically the top for
One of the top herb, we can say it is the top of the herb. So we can't give the gradings as such, but like now basing on the thing. But and then as it is like a household availability also.
yeah,
So which is available
it's available. Yes.
easily. So that way we can say it is best. So in any kitchen, every kitchen it is there. So if I say something good herb, maybe good herbs are there, But to get that herb, you need to travel, you need to go and purchase. But these are available things, which are the good in that.
I always carry a little jar of cloves with me
Yeah.
when I
Yes.
travel. And the other day I was with my dentist, and since I'm using taking care of my oral health, it
Okay.
has improved a lot. I used to have always 3, 4 caries when I go. Once a year I go, and then she would find a few caries. Okay, and she told me, "Oh, I have one very small one this time, and your teeth are very clean. It's
Okay.
very. I'm very proud of you," she said. What toothpaste you're using, and then I explained to her that not only toothpaste, but I'm taking care more of
Mm.
using applying Ayurveda. And I talk about this toothpaste, Sudanta Ayurveda uh, toothpaste, and
Okay.
I explained the ingredients to her. It has cloves and cinnamon. I said, very good, use that. Because I had a little inflammation at that time on some
Okay.
food was there stuck in the gum. So she said, you put a little more toothpaste there if it has cloves in it and
Okay.
just keep it there. That will really reduce that little inflammation. So I'm chewing that like cloves. I just chew it and it really makes you feel it in the mouth. You know,
Mm.
it really.
Yeah. That is where it's like helpful in the not only that it's like gums and not only the caries. So it's not the one point like where it will only deal with that, but at the same time it will be helpful for even stimulant and some of the cough thing like where the phlegm formation, so that it will dissolve. So where there is an always an infection, so this will help in that.
Wow.
Mm.
I think people should have it. I also always carry turmeric for the other
Yeah.
little benefits,
Yes, yes,
antibacterial.
exactly, exactly.
I think this cloves has become very important for me because we all don't like to go to dentist. It's like one thing, and we don't like to go to doctor in general.
Yeah, in general. Yeah.
But here's the thing, and I am so happy that Ayurveda has helped me with this dental health, and I'm really, really appreciating that. Especially this
Yeah,
product, Sudanta, has made a big difference for me since I'm using it. Um,
here that is where the reason, like, see, Ayurveda, though it is we much care think about that dental care and then oral care that is coming like new generation or the new science, but it is well said in Ayurveda scriptures, like very old script, like 5,000 BC ago, wherein it's mentioned that the daily regime, we call it as dinacharya, it's called as a daily regime. So one of the first thing that we need to detox the things of the like so mainly the oral health, how we should take care of the oral health, like take care in that. So that there is a part of the things where we consider like one dincharya and another is the rutucharya, seasonal regime. These are the two pillars of like how to protect the where we are the Ayurveda concept of swasthasya swastha rakshana we call that is like health of the healthy person. So health of a healthy person, to protect the health of healthy person or to keep health of a healthy person, we need to follow these two, like dinacharya and then the rutucharya. In that dinacharya, first thing is the daily regime. That is the first thing that it is the like how the dant davan or like dant this is oral care should be taken care by different types of tweaks and then which I mentioned like gargling or the mouthwash. We call it as in different Sanskrit names like gandusha, kavala. Like this is the terminology, but it is like it's a gargling or the oil pulling. These are the things that are there, which will helpful for the keeping health of a healthy person. So when it is that much importance is given, then definitely it is having a role of thing that to protect our things.
I love the dinacharya that you mentioned.
Yeah.
Oil
Mm.
pulling with maybe sesame oil or olive oil, then gargling with some water, with salt maybe, and tongue scraping.
Transcripting.
This is
Yeah.
also very good. And there's one good product that Sri Sri Tattva has. This is Sudanta drops. Just to
Ah,
have
so the drops application.
very good.
So when there is a so this when you see that so the Sudanta drops, so this is again the like oils that are like where it can be when there is a localized attention to be given, cure, like where bleeding gums. So apart from brushing, after that, this can be applied, and so that the health of the gums will be like the strength, because that is where the strength of the teeth lies. It's
Yes,
not,
gums.
yeah, it is
Ah,
there. Yeah, gums are the like where the health of the teeth lies in that. So if they
yes.
are very, so that localized of the application will help further after brushing that, after using Sudanta also we can apply that, so that the gums also to be taken care in that, and then proper circulation of it. So by rubbing that, so that even physically also we like generally in the brush we will be using only on the teeth, but this when you apply the Sudanta drops to the gums, the circulation of the gums also improves. So along with the things in that.
Ah, okay. So
Yeah,
another popular ingredient
yeah,
in oral health is cinnamon. And I know that is
yeah.
also present in that toothpaste Sudanta. And here in Europe, cinnamon is even much more popular than cloves. We have it in sweets, desserts, and we know also that it reduces, I think, blood pressure. So, how is it connected to dental health, cinnamon?
So these are the out of the like as when mentioned in that in the beginning, some group of herbs are there which are good for the dental health or the oral health, we can say. So these are mainly the oral health. If you see the formation of the plaque is nothing but an microbial film, biofilm that forms. So it is nothing but a bacterial thing that is there, and then you have a useful bacteria which is required for our thing for our survival, for even digestion, and then even for the health. So here, when we use these things, whether it is clove or the cinnamon, so because of the reach, like more cinnamon usage that you have mentioned that in many things that you use in the different dishes and in this thing. So there also again when this is these things have a antimicrobial properties. It contains like no cinnamon aldehyde. So these are the okay we able to came know that few of the components of it, but otherwise as a whole herb as a cinnamon, it is good for as an antimicrobial. So the plague that is formed, so which is an microbial film. So to control that or to remove that, we need an antimicrobial properties, but at the same time it should not be harsh on the oral health, on the oral mucosa or on the surface of the things, where the layer. So here, these things, natural product like herbs, which come from the nature, they are together with the nature. So, that will be they are together with the nature, and then this co-survived. So that is where, so it will not remove all the bacteria. It will be where there is a harmful bacteria, so that it will controls, and then useful bacteria it will keep, and all the like unnecessary or the harmful or the pathogen, so that will be controlled. So that is where this herbal component is useful for us, whether it is clove or the cinnamon. So these are the specialized, or we can say, out of the available in nature, what nature has given us, many things are the abundantly. So out of that, these are specialized things which are good for the oral health, and because of their properties, now the modern science evaluated the presence of different chemical nature of the presence of the which are helpful as an antimicrobial. So that's why we, though it is cinnamon, one cinnamaldehyde is present, we don't extract that and use it in our sudanta. We use it as a whole because there are other things will be there which are good for antimicrobial properties, and then what are the cinnamon effects. If when you extract only one cinnamaldehyde and then add to the toothpaste, then it may not be good because it will become again a chemical. So, and the concentration. So that here we take care of that so that the whole herb will be added to the other sudanta in the formulation
Like a
extraction. Yeah,
powder.
whole yeah powder or the whole herb. We do a different type of extraction method where the Not only a single component comes into the product, but the whole goodness of the cinnamon or the clove come into the
Wow.
formulation so that it will be good for the same what the characters are given or attributed in healing of the thing. The same will be, and also you, as you rightly said, it is used in the culinary things for the like no some of the food item. So here, if you see the cinnamon, like when your oral health is good, like it will called as a stimulants because you are having a taste buds, so that are will be coated by the biofilm that are present. So that should be cleared off so that you will be experience the taste of the food. Once you have the taste of the food, then like no, like instantly you will feel that a good digestion also when it goes in. You are like inviting the thing in a good manner. If you don't have a taste, then you don't like it, then you cannot have it. You though you push it through the mouth because it is having that, so it will not be digested properly. So that is where these are the good things where it enhances, we can say, so the taste buds so that it will give the taste of that. So that is the reason that these are like used as a seasonings. It is not like no you cannot have a cinnamon made like no total as a bulk of the food. It doesn't require that. So this is required in a little quantity so that it will activate the taste buds and also the like no secretion saliva with the stimulant even in the gastric juices so that the food or whatever we are taking in it will have a good we can say absorption and helpful for us in our what we are taking in is properly digested and properly absorbed.
Wow.
Yeah.
This is, for me, as simple as it sounds. The food to be digested properly, it has to be tasty, not only healthy. If it's only healthy, it's not enough. Wow. And cinnamon makes food very tasty, especially desserts. I know in India you are using it even in other dishes, but it in the stomach, does it also do something? Cinnamon, like help to digest sugars or anything digestion also inside? Or
No, it delays some of the personality movements, but more onto that, like because it is having the property of more good digestion, so like immediately there will not be the spike on that. So that will
sugar
also
spike.
be helpful. Yeah, it will not be having that
That's why it's good
utilization. Yeah.
for desserts.
Mm.
For diabetes also, I think it's good, I
So
guess.
it will be like when we see with the sugars, it is there. So if it is like if you say a little bit of sugar, then you will be more mouth also will be coated. You can't take more. So sweet tooth person also may not take more. So but if this is like no, the properties of this spicy thing, like cinnamon mud, where it will gives that we call it as katuras, and then the ushnavirya of that, like potency, hot potency of that herb. So where it will be taking it and then clearing the channels also, so that it will proper flow also will happen
Yes, yes.
in it.
Amazing. I think we should all start using a little bit more cinnamon in our food. That would,
Yeah, exactly. Yeah,
especially,
it has a lot of even anti, like it's like immunity properties, also immunity
yeah,
builder.
yeah.
So where it stimulates that, like, in that way.
I know.
And whole concept of like another concept we call it as ama in Ayurveda, where indigestion things happen and where you will be finding like coated of the mouth or the tongue. So this is called as arm, we call it as like indigestion. It's not that like okay indigestion only, but transformations are blocked somewhere in the tissue level. So that will be cleared by this of the spices like cinnamon, and channels will be cleared so that the flow of energy also will be good.
Yes. Your words are very inspiring.
Hmm.
That we start using these things. The, one other very popular herb is black pepper. Everyone is using though,
Yeah, yeah,
but
yeah,
it has
yeah. Rightly said.
also in oral health benefits and gut health. Can you explain a little bit about black pepper?
Black pepper, like though it looks very small, so it has a potential, very good potential. And we consider this as a having a good potential where it can form a complex for with many other things and make it as a bioavailability. So that is the reason that this black pepper is added in many of the formulations in like in Ayurveda, many formulations. Because that time, like okay, that their understanding is different. So now even the modern science understanding, whether it is black pepper is added with the turmeric, black pepper is added with the cinnamon, there it will form a complex where it will be absorbed and then more effectively. So on its own, it works, and at the same time, when it is combined, we can say it is having a synergistic effect, and it enhances it. So when it is added with the turmeric, it enhances the turmeric effect, and at the same time, it also works the piperine, which is an alpha present active principle in that black pepper. So though it is on its own, it works, but because of its actively forming a biocomplex, complexes where it will be easily absorbed into the system and giving more effect, synergistic effect. So it is more invited into many formulations as an good supportive herb in that. So that's the same thing like how again the piperine, which is having an antimicrobial properties. So this will also be help again when we come to the oral health. So it is again the same biofilm or like no, there is a plague that should be controlled with the antimicrobial things. So that with this spice, black pepper, it will be very effective. So that is the reason that even we add it in our formulation of Sudanta, the black pepper, which will be actively working with the like in the clove or in the cinnamon to enhance its effects. And on its own also, it will work as an antimicrobial.
Wow. It's very similar to how we do in yoga because
Yeah.
we do many things, a little bit of meditation, a little bit of physical exercise, a little bit of breathing, and the breathing enhances the experience of the meditation, like the technique Sudarshan Kriya.
Yeah.
It really makes it everything deeper.
That is the reason, like if you see, it's not a single, it's a wholesome, the holistic approach. So completely the things are will be there. It's not only single molecule works for the thing. It's a many components. If one herb is given for one like therapy or the treatment, so that herb having multiple properties, so it will be having a multiple active principles in it. So the each one will be helping in like synergistically and give the desired effect or the outcome for this.
Okay. Yes, if we cannot do everything, at least we can do
Yeah,
those little things and
it's a teamwork.
teamwork.
We can rightly see the teamwork which is that will happen in the molecules.
Yes. Tell me a little bit. I have heard the names of Baku and Maya Pao for dental health, oral care, and it is also in my toothpaste Sudanta that I'm using.
Yeah.
What are these? Can you why is it there?
So this, as I write, my initial when we spoke about some of the herbs that are there for the oral health, which are listed out. So these out of that, the bakul is also one of the among them, the herbs. And then when we compare that like bakul to the clove, as I mentioned, if I say bakul, then you need to go and procure or go to a tree and then get it. So instead of that, like lavang is availability. So these are some of the ingredients which will more effective, but at the medicinal values, having a more effective way of the oral health, which will be supporting for that. The like presence of we can astringent property of it. It will helps in the bleeding of like gum tone of the muscle, so that it will be health of the gums will be protected, and that astringent taste will be holding the teeth also very stronger. So these are the some of the properties of this new herb. So maybe see, it's not that though it is we get it from there, it's hard to get. But at the same time, when a formulation to be done, we should give the best. So that is where these are the selected and then the myofil. So it is a gall which is then protecting the gall that is developed. So this is also having a lot of research that is happened on this, like no buccule or the myofil, and then specialized one where it will be helpful in like antimicrobial properties and then the anti-cavities. So where it will work on that and it will give improve the oral health. So apart from that, like it's not only the spice thing. So these are the some of the things which are specialized in oral care. So that are added to the formulation so that the effective care will be delivered for us.
So one thing is having antibacterial effect. That is
Yeah, antibacterial.
not accumulating plaque is another
Yeah,
effect of these herbs working
yeah,
together.
yeah.
Another thing is making gums strong.
Stronger.
Also protecting from caries, which is
Carry.
bacteria, basically.
Yeah.
Can we reverse the caries and if it's there to disappear with herbs and Ayurveda? Or it has to go to dentist and do.
No, the regular using of like no control can happen. So like so it is like one to one because of the like the extent how much damage the dentin, like no how deep it reached. So the carries also. So that can be arrested there. So they are applying that eugenol. So we need to have to the one to one. We can't generalize this.
Okay.
So like, okay, by using this, because that is specialized care that can be checked up, and then accordingly we can use these things.
Yes.
And
So
also even when there is a bleed, and when you say strength of the gums, even the bleeding gums will be there. So the
yes,
bleeding of the gums. So that also can be protected.
yes,
So by regularly using it, so it is when these buccule and myofil, these are astringent property thing. So it will help to have the strength in that, so that like the bleeding will be stopped. Regular using. So there will be in general the improvisation of the oral health will increase, and then the bleeding also will stop. That. So and then again there will no further infection also happening in that.
yes. Bleeding, and I used to have this issue with sensitive teeth. I used to need this chemical expensive toothpaste to help, and now with this Sudanta, this sensitive teeth has disappeared. I don't have any pain from cold or from sweet or from when I touch with toothbrush. What is it making it help, Sudanta? Which
The
ingredients?
ingredients in the Sudanta where it's like it's not first thing harsh on the teeth. So it is the moment when it is not harsh. So the natural whatever the calcium that is coming from the body and the deposit that will be happening. So you will not be like that is where it will not erode anything. There will be not erosion will not happen in that. So because of that, the deposit will be there, and then it's gentle on the teeth, and but at the same time, the formation of that like anti with these antimicrobial effects of the teeth of the ingredients, so it will be protecting. So that will not further decay of the teeth will happen, or the coat will not be reduced in it. So that the sensitiveness will not increase, like it will not give the sensitivity of the teeth
It's a holistic approach.
approach. Yes.
And other toothpaste, especially in the West, the not healthy ones, they use microplastics in the toothpaste so to increase friction so they can clean. Because my dentist, she told me, you don't have anything stuck to your teeth. They're very clean. Nothing is pure. So how do you achieve that in Ayurveda and in Sudanta? Because you have created this amazing product, Sudanta. Instead of microplastics, how does it work?
No, it's when you see it's like when you see on the
And you said it's
microplastics.
very gentle also. You said very gentle. At the same time, it's clean.
Yeah, it's like see when you see the oral health, so it doesn't require something which is very harsh on that. So we are educated. It is only the basically physically we need to. Nothing should be stuck to the teeth in
Yes.
between. So once you are there into the type of where food habits, good food habits also. So where it will be like, and brushing, we can say that brushing once in a day, or
Yeah.
we will say that brushing once in a day and brushing once in the night. So it is
Yes.
a two times in a thing. So after having the dinner and like before the breakfast, which will be in a habit of it. So where there like when we take a food, so we need to keep that thing. No, physically there should not be any stuck between the teeth, and even regularly flossing also sometimes. So that will also create some more gap in between the teeth
True.
continuously. So instead of that, like more we'll keep in the even the water, like gargling, like oil pulling. So these are the things where it can take out the which is stuck in between the teeth.
Oh.
So that in a healthy manner. So and try to avoid that. It's like it's not be stuck to the teeth and leave it like that. So that is where total damage happens. So when it is stuck to the teeth and then it is left over, then the presence of the good bacteria also, and then some starts to form a plague, and then the bad bacteria also starts like no more onto that deposit, and then the caries start formation, tartar, and then these are some of the development and calcification happens. So this is the progressive way of like deterioration happens or the bad things happen. So you need to control that at the first step. So where physically, like we need to see not to have any stuck in the teeth. So here and then not using any harsh chemical so that it will not be happening. So that is where the gentle on the teeth it will be, and then it will be protecting so that the sensitivity also will not be happening for the teeth. And then these I can say herbal ingredients will be helpful for you in a natural way, like eugenol or from clove or from the cinnamon. So these oils will be helpful as a coat, which will not like further deteriorate the tooth.
Thank you so much.
Yeah.
I I know in the West there are healthy toothpaste, and people try to make something healthy without fluoride because I know Sudanta, your toothpaste is without fluoride, but
Mm.
they try to make healthy, but people say they are not effective. They don't clean the teeth. And I think the main thing that works for you in Ayurveda is the ingredients that you are using
Yeah,
and the
exactly.
herbs. Not,
Exactly.
not
Yeah.
putting any extra kind of harsh things, but the herbs
Yeah.
themselves are the, yeah, you're putting the right herbs. I,
Yes, exactly. So
yeah.
when we are see when the same type of action can be done by the chemical, and also we can do that with the help of a herbal ingredient.
Yes.
At the same time, like no, the health of like natural ecosystem at the oral, it will be mouth. We can say it is protected with the with these herbal ingredients and the herbs.
Mm.
So that may not be some. That is the reason if the toothpaste is having some harsh chemical in it, it may be good for removing the bacteria, but it will take out the good bacteria also. This may be antimicrobial thing, the ingredient, but it will. But here in the herbal concept, it will be helpful in the good bacteria. It will protect, and all the bad bacteria it will be controlling on. So that is where, because it is a natural one and it is together with the ecosystem.
Yes. And something other new for me is you said flossing might have a negative effect. If you do too much flossing, the space
Yeah, too
increases.
much. It is like where it's a physical, no? It's a
Yeah.
physical thing. Yeah. So
So
instead of that, more onto the we can go like okay, if gentle doing. See anything hard, anything more, anything is always bad for that. So
bad.
a gentle way for that, oil like gargling with like no mouthwash type of thing with the herbal ingredients, and then going with that, so that where there really physically there is a gap, the water can flush it out. So that is where the oil pulling, it is advised in Ayurveda to do regularly with
Regularly. Or,
coconut
or
oil.
Oil pulling
Coconut.
is recommended to do in the morning, but you are saying
Yeah,
also in the evening we can do to
yeah.
remove.
See, the current, that's what it is like availability of the time and we should not be like panic. We didn't do that, but it's an advice to do that so that it will be more effectively. You
Yeah.
will be protecting the health, oral health in that.
Wait, you said, I sorry interrupted you. You said coconut oil,
Yeah, coconut oil. We have that
olive
like
oil.
cold pressed
Yeah,
olive oil or coconut oil, sesame oil.
sesame
So
oil.
the oil, yeah, in that.
I know coconut oil is a little bit more strong and a little aggressive. It
Hmm.
can cause a little bit if it's done too much. And the others are more gentle. It's true,
Yeah.
is it?
Yeah,
Yeah.
it's really like where the thickness, like viscosity of that, like how the density and that, so that
Yes.
it will for moving also the gargling also it will be easier.
Mm.
So it should not strain the muscles. It
Yes.
should not. That's like the even that will help even when you see that more of the anxiety or the stress which is stored on the buccal muscles when we that will also be relieved and you will be lot of relaxation will be feeling happening on that stress relieving when you do after the like gargle. It is not only the oral health and then about the teeth so are the gums. So even when you see that like no facial muscles which takes a lot of stress, that also by doing this gargling will be relaxed, and then that will be helpful for the I mean like no stress levels to come down and the proper sleep and other things also will be follow on.
Yes, 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 yes. Amazing. And many benefits of Ayurvedic toothpaste, especially the Sudanta. And another one is the bad breath,
Yeah.
which I heard is a reason indigestion, one reason. Maybe you can tell us more. And how do you, because it's very good also for this, how do you tackle this issue with the Ayurveda?
See, like say when in the beginning I just mentioned you that when there is an indigestion or ama, that's where the tongue will be coated, and then properly it is that's ama. It's a, like where we call it as an indigested food one way aspect. So when it is the food is not properly cooked or properly like it started so when having a contaminated thing, then it like that foul smell that is happening there. So the same thing in the body also if it happens, so it will be like stagnate and then stale. So that will give that type of the flow. So it's not only the oral health like related to the only the teeth cleaning or the gums or the, so it may be internal also internal. So like some of the spices that can be used like ginger that can be like no pepper black pepper and a cinnamon tea that also will be
Here in Europe, we use mint a lot in the mint tea, different dishes with mint, and also for freshness of breath. And in Ayurveda, do you also use mint for its qualities for oral health and also digestion?
yeah, it's the menthol. We consider that it's a useful as a, like all other spices things helpful for the digestion. And when you see in the modern aspect also, it is like no mild antimicrobial thing. So where it will be like no, reduce the sulfur producing bacteria order of it. So it's like my mouth orders it will decrease, and at the same time this will be like in either the perspective, it increase that cooling effect or the freshness of the thing, so that it will help for the we call it as agni. So where it will kindles that and it will helps in a good digestion and all. And it's not very harsh on the things. So it will. That is the reason that it doesn't increase any acidity or the acidic things in that. But once it is boiled in the water, like where it is like a mint tea, so that is also helpful for the cooling effect of the body. In that, yeah.
And how about salt? I know rock salt or also charcoal is used in toothpaste. How do they help also?
See, when you see the rock salt or the charcoal, so these are a little where you need an abrasion effect also. And also the minerals that are there in the rock salt will be helpful for the deposit where it forms a coat on that like the tooth, and it helps in that. And you see a salt per se, it is not very extracted fine filtered salt. So it is a crude original form, which is having a many minerals inherently present in it, naturally present in it. So these will be effective at the minimum dosages when it is present in the toothpaste, when it is added. That is the reason in the olden days, even plain rock salt they used to have it for the as a teeth, cleaning of the teeth in it
Wow.
and protection, and even that will be helpful in even antimicrobial things also, and then the gum health also it will be good for that, and that is where we add salt to taste, so that is where it will also clear the channels of the taste buds, and then gives that as I in the beginning mentioned, so unless until the taste is not there for the food, so that it will be able to take out that. So it sharply gives it.
Wow. Coming back to the nice part, the taste.
Yeah, taste.
And Sudanta toothpaste that I use is also very tasty, and kids like it a lot. That's the funny part. Um, Very grateful to you that you have shared with us these insights and you have inspired us to use more of these herbs in our daily life.
Nice.
So I hope that we meet again and have another podcast with you. Maybe we can
Sure.
talk a little bit more about
Yeah.
Ritacharya, that you mentioned the seasonal regimen of
Season.
Ayurveda, or Dinacharya, the daily regimen. All very big topics.
Yeah, it is like as Ayurveda when the holistically when you want to discuss. So as I mentioned, it is like no health to keep healthy people health, how to restore it. So that is the main objective, we should say, or the fundamental of Ayurveda. So, okay, for the when you are out of the health and then curing with some other medication or therapy, but these are the things which are essential to be followed in a daily and on the seasonal changes so that we will not have any sicknesses that will be happening. But
Thank you
yeah,
so much.
thank
I like this logo of our conversation. Keep the healthy people healthy. So this it's
yeah,
something new for me for Ayurveda, but I will remember that. Thank you
yeah,
for your time and
yeah,
hope to see you soon again.
yeah. Thank you and nice to speak to you. Namaste.
Yes. And thank you for, yes. Okay. Doctor, just 5 seconds, doctor.
Yeah, yeah, it's okay.
But we have to put this inside because I finished everything now. You have to cut and put inside, Mary. Uh, Dr. Reddy, you are expert in certifications, organic, bio-eco. Um, can you tell us a little bit more what is your successes with toothpaste, certifying them and how?
See, that is where we learn EcoCert certification that we had for the Sudanta. Where, see, now when I want to speak to you, like I can, as a person in person, I can say about the qualities, goodness, But a person who wants to pick up on the shelf, should also be ensured that, or he should be confident, like what I am speaking now to you, the product also should speak. So that is where the certification come into it, like when the EcoCert, where now using the ingredients which are not harsh, which are natural, and the ingredients which will be the environmental friendly. So these are certified. You can see it is available on the public platform on the EcoCert, this thing, green portal, and then those ingredients are already used and the process also is certified by them, seeing that okay, now it's a when we go further it's always the with third party certifications, we call this one as and the voluntary certification, so that will ensure that we follow the procedures, and every frequently we will be having a recertification, that will be audits will be happening with them, and then it will ensure that the previous records will be verified, and also the how we are made the batches. It's not the past batches, how we made that records are verified, and then they said all the ingredients are used in a accurately, properly used it, and the ingredients are that like safe to use, and all the COA, we call the certificate of analysis of each ingredient, testing of ingredient will be submitted to the reviewing authority, so that this will have that mark of EcoCert, which will help you for the end customer. So tomorrow you will be keeping the thing in the shelf. You can't speak to each customer. So, but the product will speak, and then the mark will speak.
Yes, yes. No heavy metals, all that stuff is
Yes.
tested. And
The-
I know you, besides the certification, your toothpaste has won an award for best toothpaste, the Dentist
Yeah.
Association. Congratulations.
Yeah. Thank you.
Again,
Yeah. I'm saying thank you.
so thank you for everyone for viewing and being with us. Really appreciating your support and looking forward to see you on our next episode on the Gut Code podcast.